Here is your stem. Okay, so if you've read and
Okay.
understood, considering
Yeah,
it
ma'am.
history taking station, please help me and tell me which bone are you looking at here on the left hand side?
Hip bone.
Okay, how this hip bone is formed?
Yeah. It has the several parts:
Three parts, yes,
acetabulum,
yes,
ischium pubis, and
yes,
the ilium,
ilium. Okay,
iliac bones. Yeah.
okay, right. Three bones they unite or form in acetabulum to form hip bone. Right. Can you please tell me if you can identify this structure 22 over here?
Yeah. Posterior inferior iliac spine.
23,
Posterior superior iliac spine.
28.
Tubercle of the iliac crest.
Okay. Please identify structures on the right hand side. Number
Yeah.
5. Which muscle is attached
The
here?
yes, gluteus maximum arise from the behind the posterior
Okay.
gluteal line.
Just identification. Number 6, please.
Yes. Gluteus medius.
7.
Gluteus minimus.
You're not keeping, right? I can hear paper. 10, please.
Yes, anterior superior iliac spine. The
No.
sartorius origin from here.
Okay. Number 14, please.
Number 14.
It's a very famous, very big muscle.
In this, yes, yes, uh, the posterior group of muscle arise from here of the
Quadratus.
thigh.
Quadratus.
Quadratus femoris.
Yes, please. Tell me the origin and insertion of this muscle, please.
Rect, rectus femoris muscle.
If you can tell me the origin and insertion of quadratus femoris, can you, would you be able to?
Ischial tuberosity arise from the
Yes.
ischial tuberosity
And inserts into?
and yes, insert into the tibia.
No. Okay, we'll come back to this later.
Uh,
Please identify 18. 18. Another famous big muscle. Okay, please tell me how the hip joint is formed.
hip joint is formed by the hip bone,
Yes.
femur,
Yes.
head
And
of the femur,
head of the femur and the hip bone and what comes here in acetabulum?
acetabulum, acetabulum,
Anything else in between?
the head of the femur,
Please tell me what are the stabilizing
labrum,
factors? Labrum, yes. What are the stabilizing factors of
labrum,
the hip joint?
acetabular labrum,
Excuse me. Please tell me what are the stabilizing,
ligaments,
yes. And,
acetabular ligaments,
and which ligaments?
the labrum.
Okay, we'll come back to this one later because I want you to tell me the details. What are the factors which stabilizes the hip joint? Okay. Now moving on, please identify in the left hand picture structures from 1 to 6. What is 1, please?
Acetibular labrum.
2.
It is the head of the femur.
Would that be, what is this blue thing? Okay, what type of joint is hip joint?
Oh yeah, the phobia of the head of the femur.
What type of joint is?
Yes, hip joint.
What type of joint is hip joint?
Yes, it's a ball and socket variety of synovial joint. Ball
Good.
and socket.
What type of movements are allowed or present at hip joint?
Flexion, extension, medial rotation, lateral rotation.
Okay. Please, would you be able to identify other structures? Like 3, 4, 5, and 6? If not, then we are moving here. On the right hand
No,
side,
please
would you be
ask.
able to? Yes? No? Here? Okay, we are moving here. Would you be please identify structure number 3?
Yes. Head of the femur,
2, please.
greater trochanter,
6, please.
neck of the femur,
4,
intertrochanteric line,
5,
laser trochanter,
9. It's a shaft.
shaft, yes.
And this 11.
Yes, 11, greater trochanter.
Okay, please
Quadrate
tell me
tubercle.
on picture A on the right hand side if you can identify number 3, 12, and 5.
Yes, 3 greater trochanter, 11 quadrate tubercle,
The 11 is here, but 12 and 5 I asked.
intertrochanteric line,
Okay, no, not quite. Okay, please tell me what is attached at number 8.
laser trochanter.
Attachment, please.
Attachment is iliopsoas muscle.
Okay, what is 4?
Phobia of the head of the femur.
6?
Six.
It's
Just spiral
okay,
line.
we'll come back to this later. Please identify, okay, this is the superficial and this is the deep, as you could see. I want you to identify from here. What is this? This is ilium.
Gluteus,
Sacrum.
medius.
Okay, medius. And then this one. Is
Maximus,
this?
gluteus maximus, then gluteus medius.
Okay, and on,
Maximus, gluteus maximus.
okay, no, you're not identifying it correctly. Can you please identify this muscle? 1, 2, 3, 4, 5. All these, if you could identify. No? All right, we're moving forward. Can
No.
you please tell me what are you looking at? What kind of image is this?
Yeah, arteriogram of the lower limb,
Okay,
the
can you
pelvis
give me the
region, and the
indications
upper
when
thigh.
you will ask for this investigation?
Yes, there is a peripheral vascular disease.
Yes. Please identify the structure 1 to 7. What is 1? One. Okay. 2.
One is the
Catheter. 2.
external femoral artery.
Okay.
Femoral artery.
3 and 4.
3 lateral circumflex femoral artery, 4 medial circumflex femoral artery,
5 and 6. 5, 6, and 7.
6 artery of deep femoral artery or profound femoral artery, 5 perforating artery,
Can you please
7
identify? Okay.
superficial femoral.
What kind of image is this, and when do
Yeah.
you ask for this investigation
It's also arteriogram. The
of the leg?
I can identify, ma'am.
Yes, please, please.
Yes,
Tell
of
me.
the leg. Popliteal artery,
Yes, very good. And
then tibiopopliteal trunk. Yes, it's anterior popliteal artery. Anterior popliteal artery. Medial peroneal artery, and
okay,
medially posterior femoral popliteal artery.
good. Thank you.